And just to kick off by saying that a lot of the arguments I'm going to talk about are encapsulated in the publication you can see on your screen, which I think is in at least 17 languages now. And CIICA will be looking to update this publication over the next year, hopefully, but it's still very current for what we've been talking about tonight. The next slide, please. We've already heard from Sue and Connie earlier that there's really mixed funding across the globe in terms of cochlear implants. Our survey, 67% of implants publicly funded, while 35% funded from insurance or privately. This reflects roughly the proportions that have been found in other big studies. And we're also aware that audiological criteria and waiting lists put limits on the numbers of implants fitted. But without the funding, crucially, it's very difficult to address some of those other issues around waiting lists and audiological criteria, because often the two partly go together. Ongoing support has different levels of funding across the different countries, and thanks hugely to Carmen for just a brilliant illustration of the complexity of that funding in one particular country, which has already kind of made some of the key points I was wanting to draw out in this in relation to Brazil. And we know that funding of implants and ongoing support has a significant impact on the availability of implants and decisions to have an implant and the quality of life after an implant. Next slide, please. And where I think this report really makes a difference is making us think. We've focused a lot in the sector on getting the funding to get people with their implants. What we've heard time and time again tonight is that we really need to think much harder now about how we fund the long-term care costs, because otherwise all that upfront investment can be completely wasted. And I won't read out the whole quote because you can read it in the survey, but it's obviously really crucial to many of the people that responded to our survey. Next slide, please. Just looking at the different funding models, and we've heard of literally all of them tonight at some point, we can have universal government funding, which is relatively rare across the globe. Not many countries have completely universal funding. There's a lot more examples of insurance-based government or state insurance funding, which, depending on the scheme, people with higher incomes can be required to contribute to. We then have private health insurance funding, and then we have self-funding. And often in different countries, we can have mixtures of those for different parts of the process. And that's one of the things that Sue was drawing attention to from the report, in that we can have this very fractured funding environment where different things get funded differentially. The problem with those different funding systems is they create confusion for users, they create blockages between where people can and can't get services, and crucially, in private funded systems, they provide disincentives which favour recommending continued use of hearing aids when often people need cochlear implants. But as Carmen was drawing attention to, there's lots of potential innovations, both in terms of e-health, in the way manufacturers think about, in the way that we actually fund different parts of the system, where there could be lots of innovations that might start to address some of this. Next slide. And what we do know, and again, I'm not going to read these out because they should be engraved on all your advocacy documents, is that there is overwhelming proof that both for adults and for children, investing in cochlear implants, both the implants themselves and the rehabilitation services, means overall savings to health systems. I know that can be challenging for low resource and middle resource countries sometimes, but it's nevertheless true that anything invested in this area will pay back into the health system and into the bigger social care system around that. Next slide, please. We also know that there's an impact of funding on users of CI, who often themselves think that CI is too expensive and they won't be able to access it. Very interesting study from Australia that showed that many people that were eligible for CIs did not consider them because of what they imagined to be the cost of having one, and thinking that they might not be eligible. And they thought that only children would get priority and didn't think they had a chance of getting implants. And also that was true of audiologists. So there's a major education piece here, both for the initial fittings and for rehabilitation, in terms of addressing the perception that cochlear implants are one, too expensive, and two, can't be accessed through some of these funding systems. Next slide, please. So what's needed for the future, and this is the kind of crucial bit I just want to reflect back on, and again, Carmen's raised one or two of these questions already in a really helpful way. We do need to look at innovative ways of improving finance for implants, especially in medium and low resource countries, so they can really take advantage of those opportunities to actually save money within their health systems. We can look, for example, at many of those insurance schemes across the world to ensure that we can get better access for groups. Recent changes to Medicaid in the USA, extending that to low-income groups or extending the criteria, are both really good examples of how we needn't just take insurance schemes where they are, but we can look at expanding them. We need to find better ways of demonstrating the cost benefits, especially when the savings are not from the same budgets as the initial cost of the implants. And that's often a major problem. There are savings, but they're not always where the implants are being funded from. So we need to look at how government and commissioners actually fund implants and rehabilitation and aftercare. And we need to look at how we can increase the value and reduce the cost of implants through design, through e-health, through more innovative funding and more innovative service arrangements, which also looks at some of the issues raised tonight around patient literacy and how we can ensure that people are actually empowered to be part of their own self-care going forward. And we also need to know and look at what examples we've had, like we've seen tonight, of successful campaigns that extend the criteria and the funding. Next slide, please. So, just in conclusion, and trying to wrap up this evening a bit, we often talk about CIs as if they're an expensive solution, and this leaves everybody thinking it is. We need to keep talking about CIs being an investment, both in terms of the initial CI and in terms of the rehabilitation that follows to make the most of that investment. Costs more not to take action to address hearing loss. Improved take-up of CIs is a solution to improve health and to save money, but we also need to ensure that the support is in place for the lifetime of the user, and that's the crucial key message from this evening and from the latest report. And we need to continue to advocate for the benefits of fully funding access and support for the CIICA, for cochlear implants, and CIICA is there to help support those efforts. And please go onto the website and look at all the other resources we've got to help you in your advocacy efforts.